Greetings. I'm Dr. Javed Butler. I'm professor and chairman of the Department of Medicine at University of Mississippi in Jackson, Mississippi. I was the co-principal investigator for the Emperor Preserved trial, and that's the trial we will be discussing today. So the rationale for Emperor Preserved trial was to assess the impact of empagliflozin on outcomes in patients with heart failure and preserved ejection fraction. Obviously, we know before Emperor Preserved came out that there was no trial that has ever been positive for its primary endpoint. So this was a big unmet need. The study that was presented here at the American Heart Association was focusing on the quality of life outcomes in patients with heart failure and preserved ejection fraction and how it was impacted by the use of empagliflozin. And there are sort of two questions that people ask. One is obviously our patients not only want to live longer and have less hospitalization, that obviously is very important, but also whether the therapy improves their quality of life and health status. So that's sort of one question. And then the second question is, are there some patients who are just too sick or too healthy at baseline to actually benefit from medical intervention? So what is the impact of health status on clinical outcome, and what is the impact of therapy on health status? So these were the two questions that we asked in this particular study. So the health status was measured with the use of a validated questionnaire called Kansas City Cardiomyopathy Questionnaire. We used the 23-question version. These questions are then divided into three domains. So one domain is related to symptoms, so symptom frequency and symptom burden. That is called TSS, Total Symptom Score. If on top of the total symptom score, you add physical limitations, then it becomes CSS, or clinical summary score. And on top of clinical summary score, if you add other domains like sexual function, social integration, quality of life, then it becomes OSS, overall summary score. So all patients in the trial were asked to fill out this questionnaire at baseline to get an idea where is the starting point, and at 3 points during the trial. At 3 points to assess early changes, at 8 months to assess intermediate, and then at 12 months to see sustainable changes.